Do minoxidil shots with needles usually help this kind of thinning hair on hairlines?
Thank you for your question. You submitted a photo, a close-up of your what appears to be your frontal hairline and your part, and you're asking if minoxidil injections typically helps this type of area, the frontal hairline. So certainly I can share with you the basis for the use of minoxidil and certainly how I approach hair loss in our practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Hair loss is a big part of my practice, and in fact I'm the founder of Tricostem Hair Regeneration Centers. This is a non-surgical solution that we developed using a acellular matrix and PRP for hair loss for both men and women, again, without surgery. So I'm going to give you more details about this as I further discuss your concerns. So, I think that it's interesting that you are asking about minoxidil injections. As you may or may not be aware, minoxidil originally was a drug used for hypertension, and it was in around 1980 that it was noticed that there was a stimulation of hair growth with this drug, and so the rest was history. A topical form was developed that was basically applied once a day to essentially stimulate some growth as well as to prolong the growth cycle of thinning hair. And it's been a successful way to manage hair loss, but it doesn't stop the progression of hair loss. Now, for years, people have tried different ways to further enhance the absorption of minoxidil. This includes different formulations where the top layer of skin is actually, you try to break it down or thin it out so that it gets more absorbed. This very often customized formulations include topicals such as retinoids to help improve absorption. There are also methods of doing microneedling to again further enhance absorption. And undoubtedly there's going to be some thought or somewhere that they're going to do injections. The challenge is, of course, is how sustainable are these treatments? How often will you get injected in order to sustain growth? You see, the challenge is that your concern is about the frontal hairline, but most often that frontal hairline thinning is also a reflection of more diffuse thinning. And so how many places can you get injected and how sustainable can this be? Currently, when it comes to hair loss, for men there is Propecia or finasteride, which is an oral drug, topical minoxidil, and hair transplant, and we've developed a category called hair regeneration, which I'll discuss again further. Women, it's basically minoxidil and nothing else other than surgery, and again, hair regeneration. So a little bit about hair regeneration, because you've already asked about injections, and injection is what we do with this treatment. Hair regeneration evolved out of our desire to improve outcomes with hair transplant. With hair transplant, there was a lot of frustration with the yield of the grafts in terms of the numbers of hairs that survived, as well as the proper healing of the donor area. Well, a side effect was noticed, which was that thinning hairs in some patients got thicker. This was something that we started about 7 years ago, and we ultimately, through very rigorous process of analysis and development, we created a protocol for different types of hair loss based on gender, degree of hair loss, age of onset, and essentially an algorithm. And what we're doing is we're injecting a combination of acellular matrix, platelet-rich plasma, vitamin D, and doing this for both men and women with the highest level of success with what's called androgenetic alopecia, or genetic pattern loss. Now, this injection, typically, when we first started doing this, essentially we were able to observe that the hair sustainably grew and stayed constant for over 5 years. And we've certainly continuously evolved and improve our algorithm and process, but essentially a single set of injections at one visit was very, very effective. Now, we've further developed other protocols, but when it comes to other types of injections, whether if it's minoxidil, it's likely you're going to need to do something like that monthly, and on the outer limit, maybe 3 months. The same goes for what is basically routine PRP injections, platelet-rich plasma. Again, hair regeneration is a combination of acellular matrix, which is a wound-healing material that is based on this very advanced stem cell technology that's used for other areas in surgery to improve wound healing, and the use of platelet-rich plasma. Platelet-rich plasma is derived from your blood, and it's a concentration of the wound healing and growth factors necessary so when you get a cut, you're actually healing. Basically, we've evolved into a level that is, I think, is the next level of medical care, which is using your body's own ability to heal, to manipulate what appears to be a pathways of hair growth in the physiology of hair. So again, it's not. I'm not saying that it's necessarily a perfect solution for long term beyond 5 years, but compared to what is currently available, it's been extremely effective. With both men and women, we're seeing over 99% success in terms of stopping progression, reactivating growth, and prolonging hair growth cycles so that the hairs continue to grow and doesn't require continuous, constant treatment. So I think it's important that as you're exploring injections as a category, learn about the different modalities and always ask the question, how frequently do you need injections to sustain growth? I'll tell you that a lot of our patients come to us after they've tried other modalities with injections, and if they were, for example, if they're going for PRP injections, they're getting them once a month, and after 4 months, they start to feel like they didn't know where their endpoint was and how long could they keep getting poked in the scalp. And so it's very important to understand that and understand what kind of real outcomes you can achieve. So there's certainly more opportunity for you to do research, and once you have completed the acquisition of knowledge, you should move forward and meet with doctors and learn about your options from them in terms of the specifics as to what you can expect for your situation. Again, it's very important to also make sure you have the right diagnosis before you move along with the treatment. So I hope that was helpful. I wish you the best of luck, and thank you for your question.